Welcome everyone to another video, a segment we call One Quarter or Less here at Balance the Bar. In sports, one quarter is just one small segment of a game, a season, or a career, but it can be significant. A quarter can matter. Those 12 minutes can absolutely make a difference. And the person we have with us today to make a difference for us is Dr. Meeta Singh. Meeta, how are you?
Not too bad. How are you?
Doing great. And thank you so much for your time and coming on board with us today for the interview.
Jesse, thank you for having me.
For sure. Absolutely. Social media is a beautiful thing. Common friends introduced us, got a little over a couple months ago. I've been following all your travels and we've been able to kind of connect via email and those forums. Can you tell everybody what you're doing right now?
So I'm a sleep specialist. And I have a niche practice in which I'm advising and working with athletic teams. So in every all the major leagues, as well as working individually with players. And then it just sort of I also have this practice in which I'm advising C-suite executives of how to manage their sleep. So not just ruling out sleep disorders and treating sleep disorders, which I do because I'm a board certified sleep specialist, but also just optimizing sleep with the goal to optimize performance and health. So sleep health is not just the absence of a sleep disorder. So
sure,
that's what I'm doing.
Sure, and you've made an incredible dent and your presence in the high performance world with some of your consulting and the stuff you've done on social media, in addition to many others, where sleep has become a really more talked about topic recently, at least in my experience in the team setting, and you're helping to just grow that awareness that it is such a topic. I mean, the good teams know that, if you're doing sleep well, if you can get your athletes sleeping well, if you can handle and put together strong nutrition and you're knocking out those two boxes, you're doing some really good stuff for your athletes. And you've been able to really kind of support that topic with everything you're doing. So thank you for that.
Thank you.
Yeah. So we'll hop right into the questions, right? That is your technical expertise, but we know here at Balance the Bar, we like to talk about the other side, the interpersonal side of what makes you really good at what you do. And we like to start with little fun questions. So we'll get out of your comfort zone, get you out of the box a little bit here. So just to get to know you. So let's say you are a prize fighter. Let's say you're a prize fighter, either MMA or boxing. And I think one of the most interesting parts of fights is when they come out to the ring, and every fighter has an entourage. They have a little posse that brings them out to the ring. So who are your top two people that, if you are going into a prize fight and you're a boxer, who are the two people that you would absolutely have to have with you walking you out to the ring?
Okay. Well, can I have three?
You can have three. Yes.
You can have three.
Yeah.
Well, I would say the three people that I would have is I would have my son. He's 14 and a half. I'd have him. I'd have Kent McMacken is my business manager. He's like invaluable. And I would, if I'm allowed only two people, those are the two people I would have. If I'm allowed three, unfortunately, I'd have to bring a fourth because I'd have to bring both my daughters. So that's
Fair enough. You can't leave anyone out. That's for sure. Not when you're talking about children.
Yeah.
That's great. Okay. On the topic of bedside manner, right? It's medical doctors. It's a known term. It aligns very well with what we talk about here at Balance the Bar. We probably all have examples of clinicians in our head that maybe didn't have good bedside manner and we didn't have a good feeling about them. And then other examples of doctors that really resonated and ones that we wanted to return to for their care. Can you go back to your med school days maybe and talk about what it is they taught you relative to bedside manner and maybe what you've learned in your practice since?
So, I went to medical school many, many years ago, and bedside manner was not something that they really emphasized on because it was, and things have changed for the better since then. However, I will tell you that when you're working with, and when you are in medical school, the teachers who are kindest to you are the ones who leave the most impression on you, right? So that's number one. But when it comes to, I did my training at Mayo Clinic, and it was while I was training. I think it was in my second year. Your audience doesn't need to know the details, but I was sick and I needed this major surgery. Perfectly fine after that. And bedside manner, that made a big difference, right? Because you're on the other side, and now you're the patient, and how the physicians and the training doctors treat you, and whether it really does matter. And it matters because, it's important to listen to the patients from where they're at. So, and that's something hopefully that I do as part of my practice, Jesse. When, broadly, of course, I know sleep science really well. I know the athlete's schedule really well. But the only way to actually make a connection with the athlete and to get them to listen, especially when you're talking about things like nutrition or sleep, is if they feel that you get them. And you can only get them once you've made that connection. And that really is a matter of bedside manner. It's all that. And I would say that in the field that we're in, it's even more important, because you can give them instructions down to the minute, but if you don't have the buy-in, they're not going to do it. And so to get the correct buy-in, there's only one way. Is you have to establish that rapport. You have to understand the player and understand what their compulsions are. What are the things that they want that should happen in their lives, and that's how you get to them.
Yeah, phenomenal answer. What I heard most there is listen, number one.
Yeah.
And that's going to lead you to understanding them as an individual.
Yes. Yep. And that's really important, because it's important because a team, or especially in professional sports, they're very busy. So taking the time to sit and listen to them with all those things that are coming to them really does takes enough effort, right? Sometimes you have to actually walk to the training room while they're getting a procedure taped up, etc., and perhaps that's the only time they listen to you. You really have to find that time to make the connection, and you want to have conversations that are clear. They're candid conversations, and the player has to understand that you have their best interest at heart, and that what they say to you is in confidence. Which I mean, I'm a physician, so everything I say, we interact is protected by HIPAA, and it's only then that they will tell you what is really bothering them, and that's how you can help them.
Yep. Wow, really powerful statement for sure. And again, as we apply it to, you're talking sleep science, but if we apply it to physical therapy or a physio or a strength coach or a dietitian, we all know that really to really effectively deliver that message, that connection has to be there without a doubt. And it comes from listening, and it comes from understanding the individual and making the time. It's a really good point.